Does the risk of AF still
Mhm.
endure after coming off of ibrutinib? I've gone on to venetoclax, but I'm still having AF. So would that be a lifetime thing?
That's a very good question, and the answer is we don't have all the answers to know for sure. There is some work to say that 'cause one of the problems when people have BNF for a long time, you can get some structural changes to the heart. For instance, the right atrium can get a little bit bigger, and then that makes you more at risk of having a abnormal SORA and more likely that people to trigger to going into it. So I guess the answer is yes. Yeah, if you've been in it for a significant length of time. Yeah.
Thank you. Sorry, can I do two more? It's does the length that we're on ibrutinib or been on ibrutinib increase the hypertension risk? Is that so with venetoclax as well?
Yes, so we know that there's good data that, and that was part of the trouble with the early trials. They had a sort of readout after about 18 months. So there was quite a low rate of hypertension that was reported initially. We now know that for much longer follow-up, so there's a Resonate study, which is a big, the frontline study. We've got follow-up for people up to 8 years plus. The incidence goes up. So the longer you're on it, the higher the rate. Of course, the background is, if you just looked at the background population, as we get older, the risk of hypertension increases anyway. But it does look as though there is a slightly, an increased risk because of these drugs. And we've not seen that with venetoclax. I think that's a potential advantage. But I think, it's like all these things. All drugs have risks, and it's about being very proactive about managing your blood pressure effectively, because these are incredibly effective drugs. People have a normal quality of life. I wouldn't want people not to have access to these drugs because they're life-changing. I mean, I spent the morning doing a CLL clinic, and we've spent the whole morning talking about people's holidays and their hobbies, and they're doing these incredible cycles, across France, and so it's very, very different compared to not that long ago when people were having chemotherapy, which is can be really toxic. So we're in this of, yes, there are these risks. I think you've got to take it into the mix compared to what previous treatments. I wouldn't want people not to have access to them because of that. It's more about being aware and being proactive, because I've got lots of people, that have cardiovascular disease who are on BTK inhibitors, are staying on BTK inhibitors, and it's the right thing for them, and they're very well on it. So.
Yeah, thank you. Without ibrutinib and venetoclax, I don't think I'd be alive now, so I'm grateful to have that. I think you've answered the third one. My doctor seems to think that blood pressure is not quite so important being at 82. Is that a general medical feeling?
Well, there still are the risk factors are still there. So yeah, I think you still need to be proactive about it.
I would like to find out more about travel. I'm new to medication, taking acalabrutinib, and my spleen reading is 15. My GP tells me to avoid the USA, but is traveling to Australia okay? And also, what about going on a cruise? Very general question.
Well, it's a general question, but it's one that comes up in the clinic a lot, because people are well, and people want to get on with their lives and do these things that we all enjoy. So there's no reason why you can't travel. I think the first thing I would say, you've got to have insurance. So don't travel without insurance, and that can be quite a challenge, unfairly so, because but the key things to say, I think, shop around. If you're going to get like a travel insurance, you shouldn't be excluded by CLL. You shouldn't be excluded by being on a targeted treatment, being on a acalabrutinib or venetoclax. I think the key things to say is that when you fill out you talk to the insurance companies, you're in remission. So you're in remission on your treatment. It's stable. So those are sort of key things, but important to have insurance, because if you go without and you pick up an infection, because we know that you're more at risk of getting infections by the CLL itself, they will turn around and say you're not insured if you've not declared everything. So I think that's very important. I think travel at certain times, I'm a little bit wary. Then, obviously with COVID, we have a lot of peaks and all respiratory viruses over the winter months. So if you're flying long haul, over the winter months, you're more likely to pick up something, I would say. So you're better, you know, traveling in the summer months, perhaps where the incidence in the community is lower. But no, you've got to live. You've got to do things you enjoy.